Hello and welcome to Surgery Secrets, where we go behind the scenes to uncover secrets about surgery you won't hear in the classroom. My name is Isabel, and today we're sitting down with Dr. Wolfli. Let's get started. All right, so we'll start with some quick fire questions. So can you tell us your name?
James Wolfli.
And what is your occupation?
I am a plastic and reconstructive surgeon.
And where do you work?
I mostly work out of the Grey Nuns Hospital, which is a community hospital in Southeast Edmonton.
And what does your job entail?
Primarily, I do breast cancer reconstruction. I also do traumatic repair of the face and hand injuries, and I also do some facial aesthetic surgery as well.
What's your favorite color?
Blue.
Your favorite food?
My favorite food would be sushi.
Your favorite superhero?
I'm not a big superhero person, but I would probably say Spider-Man.
Your favorite musical artist?
George Michael.
Your favorite movie?
It would be a tie between Top Gun and the original Zoolander.
Your favorite organ of the body?
It has to be the skin, obviously.
The last book you read?
The last book I read would be Norwegian Wood, which is all about how to chop wood and burn it.
And can you recommend me a TV show?
I have two little kids, so I only get to watch like kids shows. So I would say Octonauts.
Oh, I'll have to check it out.
Yeah, and it's originally Canadian, so it's a good show.
So you passed the quick fire round, so we'll get started on the nitty-gritty questions. So can you tell us who your biggest influence was career-wise?
Career-wise, I mean, I think my biggest influence would probably been my dad, who's passed. And then my biggest influence, to go into plastics would have been Wim de Haas, who's a plastic surgeon in Calgary.
So I can only imagine how hectic kind of school would be for a surgical student. Do you have a memorable moment from your training?
Oh yeah, I have a couple, but probably the one I like to tell the most when I was a second year general surgery resident. Well, I was plastics, but we're rotating through general surgery. There was a call I got from Stars, and it was from a merge doc who had picked up a cowboy who had been stomped on by a bull, and he's a young guy, and he was unstable, and so and he was progressively getting more unstable, and so I spoke to the general surgeon who was just finishing up a case, and the chief resident. They were finishing up a case in the OR, and they said, well, let's bypass emerge and we're going to go straight to the OR. But I couldn't reach Stars anymore, and so I actually had to go up to the helicopter pad, which was like the old helicopter pad at the University Hospital, which was like super hard to get to, and security guard had to like guide me through this maze to get to the helicopter pad. And then the helicopter was landing, and like my white coat was like flying around, and it was like just straight out of MASH. And at that point, the patient had crashed to the point where the emerge doc was actually doing CPR on him, and we just said, okay, we're going straight to the OR. And so he was doing the CPR, and we were just running, and the OR was ready, anesthesia, everything was ready, and got him there right away and operated. And anyway, there was a lot of blood in his belly, and obviously I was pretty junior, so I didn't really have too much to do with the surgery, but his spleen was removed. And well, probably a week later, he walked out of hospital like just perfect.
Oh my goodness.
That was probably one of the coolest. That's one of those things. That's the definition of why you went into medicine. Practically almost dead, and then he just walked out like he's perfect,
Yeah.
10 days later. So that was definitely, it almost made me change into general surgery.
Oh, really? The adrenaline must have been pumping when that was happening. Oh my goodness.
It was honestly, I'll never forget. There was just that whole situation was just unbelievable. Very cool.
Do you have any recent memorable moments that maybe live up to that one?
No, nothing quite so dramatic. But nowadays I think probably the most memorable stuff is I have the fortune of doing a lot of cases where I actually get to work with other specialties. So a lot of times I do still work with general surgery, and just last week I got to do a combined case with one of the ophthalmologists, and just honestly kind of just seeing he was dissecting with this instrument that I'd never seen anyone kind of dissect with before. And it was kind of really just neat to see. And, you kind of still learn, and just by hanging out with other people, it's nice, and it's still a good learning experience. So those are kind of the memorable things now.
Mhm.
Less dramatic.
Yeah. Your coat wasn't billowing in the wind when you were doing that.
It wasn't out of a movie anymore.
No. So your job, I mean, I'm not in the healthcare industry much. I mean, I can't really understand what you do specifically, just because it's so out of my realm to be doing surgery on people. Would you say that there's kind of some specific things that people don't understand about your job?
Well, definitely specific for plastics is we're very much handled by what I think people, kind of see on TV. And
Mm.
so I think for the most part, if like you're at a dinner party and you tell someone you're a plastic surgeon, they automatically kind of think you're, purely cosmetic.
Mhm.
So so that's probably one of the things and that's definitely a part of our practice, but there's a lot of different parts of plastic surgery. So that's one to kind of always, just kind of, there's usually like a 5-minute educational aspect of everything that I do.
Mhm.
But that's probably the biggest one.
So what would you say is the absolute best part of your job?
So the best part of my job, I think definitely for me is when you get a problem um, that has been around maybe for a while. There's a very, very difficult problem. No one's been able to kind of fix it. And usually in plastics, what that is maybe some sort of wound or soft tissue problem that just isn't going away and is constantly causing the patient a lot of grief. And then you can kind of come in and be that person to fix it. And yeah, it's just a really, honestly, it's a super fulfilling feeling to be able to do that. And the gratitude usually at that point that the patients have is also, it's quite nice as well, because they, a lot of times they're kind of at their wits' end as well. And so to make that problem go away is pretty cool.
Mhm. So I guess on the other end of that, what would you say is the worst part of your job?
Yeah, so the worst part is because most of the stuff I do is honestly like skin deep. Everyone can see it.
Mm.
And so, be it reconstructive, aesthetic, or anything, uh, anyone can be a critic. So, you end up, yeah, you, you sometimes you can see the outward result, but unless you kind of have an idea of everything that was involved to get where you are,
Mhm.
it's hard to kind of appreciate that. But because it's visual, everyone has their opinion. So,
Mhm. Mhm.
so that sometimes can be a bit tough, but
Uh-huh.
you get through it.
Mhm. So is there anything weird or embarrassing or gross that has ever happened to you at work? Like what's the weirdest or grossest thing that's ever happened?
I don't want to get into any specifics, just for patient
Yeah, of
confidentiality.
course.
But I mean, in all honesty, because of the traumatic, some of the traumatic soft tissue injuries we see, like, are just honestly horrible. Like, I
Mhm,
just stuff I've seen belongs in horror movies,
mhm,
uh,
mhm,
not to happen to real people. So, it's we definitely see some, in 20 years of this, I've seen some really horrific stuff. So,
mhm, mhm.
but
So
unfortunately, too many to even mention.
yeah, yeah. So I mean, after seeing all those like horrible things, I can only imagine the kind of support system that you need to have. Can you tell us a bit about your support system?
Yeah, I'd say my biggest support is my family. My wife's a psychologist, so that helps a lot.
Yeah.
Uh, and then my two little kids at the end of the day, because they, they're just always happy, and you come home even after a bad day, and they're smiling, and
Mhm,
they just want a hug. That kind of makes the worst day seem pretty good.
mhm. So when you were in school, and this can be medical school or even before that, did you ever imagine yourself living your current life?
No, no,
Mhm.
no. It's funny. I don't know why I went into medicine. I can't. Yeah, people ask me that question, and I can't actually give a solid reason. I think my uncle was a physician in Germany, so when we went to go visit there, I guess maybe that had something subconsciously. But no, I was definitely more of a math and physics guy. So I don't know why I ended up where I did. I did.
So if you weren't doing your current job, what career do you think you would have ended up on?
Well, I for sure. This is funny. This is the exact same question I asked residents during the interview. So I love this one. But for me, 100% would be an architect.
No, that's actually what I'm going into my master's for.
Oh, awesome!
Yeah, yeah, I'm starting in September, so
Good choice. That's awesome. Yeah, 100%. I do architecture. I think
yeah,
it's awesome.
yeah, yeah, so cool.
Because I do reconstruction, and it's super cool.
Mhm,
But unfortunately, the human body ages and only lasts so long,
mhm,
you know. And so you can look at it and go, that was awesome, and everyone's happy, but it's temporary. Like
mhm, mhm,
we are only temporary. But when you're an architect, you can build something that's
mhm,
practical forever. And
mhm,
that's super cool. So
mhm.
congratulations.
Thanks, yeah, I'm very excited. So I guess we're kind of on to our last question here.
Okay.
If you could go back, what advice would you give your younger self or someone considering your career?
Um, yeah, I mean, I'm gonna I'm gonna sound like an old guy now, but I think probably one of the biggest things that I see have changed is the knowledge of anatomy, and definitely was kind of happening when I was going through, and we'd moved to pro sections, which are kind of um, things that are already dissected out, and the anatomy for the exam, but then you forget it, and then you always have to relearn it. Whereas the old-fashioned way of doing the dissections on cadavers, it really kind of cemented the anatomic knowledge, and it also, I think, kind of helped, you know, with the dissection, when you move to doing, surgeries. So, I would tell young learners, if somehow they can get into some extra anatomy and do some dissections, I think it would help them a lot. And as seemingly old-fashioned as it is, anatomy is still really important.
Well, thank you so much for joining us today on Surgery Secrets. It was a pleasure to have you join our series.
Thank you very much. Thanks for having me.
And there you have it. Join us next time for another exclusive look into surgery today. Follow us on LinkedIn for new Surgery Secrets episodes and check us out on Facebook, Instagram, and Twitter. For more information on Surgery 101, head to our website, surgery101.org. Thanks again, and we'll see you next time.